I have an amendment 297J, which is in this group, and I would like to speak to it. I want to preface my remarks by returning to the purpose of this bill. The stated purpose of this bill is to promote integration of health and care services in order to reduce health inequalities and to promote better outcomes. I choose in this amendment to speak on the issue of HIV and AIDS services. I have spoken in previous days about access to sexual and reproductive health services such as contraception and abortion. They are, I think, two services which we would do well to look at in considerable detail, because they are services addressing issues which cannot alone be solved by the National Health Service. They are services which will only be solved by not only integration but collaboration between health and social care. And having, like many members of this House, discussed these issues for many, many years, I come back to the point made by the noble Baroness Thornton the other day, that we are trying to seek integration and collaboration between two fundamentally different services. One which is organised on a national and essentially top-down service system, and the second which is organised on a local and democratically accountable basis with completely different ethos. And I think it is at this point worth us taking advantage of the presence of the Noble Lord Stevens of Birmingham and noting what he said the other day about the National Health Service. And he said that, by paraphrase, that one of the best ways to ensure that the National Health Service does what we expect it to do is to ensure that it has resources. Absolutely right. Would that people took the same attitude to social care, but they don't. And in both issues of both the matters of sexual health services and in HIV services, we see in graphic and demonstrable terms the failure to do just that. Turning to HIV services, I think it's important that we note that although we have overall a very, very good story to tell on HIV in this country and have a reasonably good story to tell in the last few years, as we are on a path towards a complete ending of transmission by 2030, we do have some problems. Last year, the number of people living with HIV in the UK rose to 106,000. In 2020, the number of people being tested at clinics decreased by 30%, and that was more so in minority communities, in black and minority communities, where late diagnosis and all the complications of late diagnosis remains stubbornly high. What did happen was there was a very big increase in online testing, and HIV is an area in which there have been and there will be over the next few years huge changes, technological changes in diagnosis and in treatment, which the NHS and social care should be up to speed with if they're going to get to the stated aim of ending transmission by 2030, which we can do. But the problem is that we've got at the moment an increase in the rate of late HIV diagnosis. That was up to 42% in 2019, and we know the concomitant costs that presents for the health service. But as I just practically, if anybody has spoken to anybody involved in HIV services, be it in social care, local authorities or NHS, they will have heard exactly the same story since 2012. So let's look at commissioning. Commissioning for HIV testing, it looks like this. The HIV testing in sexual health clinics is commissioned by local authorities. Right. HIV testing in community settings, commissioned by local authorities. Right. HIV testing in GP settings, where it's clinically indicated, NHS England. HIV testing in GP settings as a public health intervention commissioned by local authorities. HIV testing in secondary care, where it's clinically indicated, CCGs. HIV testing in secondary care as a public health intervention, local authorities. Keep with me, keep with me. HIV testing, new home testing increasingly unpopular, local authorities and Public Health England for some periods at some time of the year. Is it any wonder that it's a mess and that we are not taking advantage of any of this in any way, and we're letting people down? The fragmentation in this area, even for people who have HIV, who are some of the savviest patients the NHS comes across and are up to speed on something sometimes in advance of their clinicians, is really, really difficult. And it does not make sense on any level. It doesn't make sense from a public health level, it doesn't make sense from an individual level. So, the point that I want, I don't need to go into great local lords can work out for themselves all the consequences of that. Not least, but I think it's quite interesting that we're to talk about one piece of work which the All-Parliamentary Group on HIV/AIDS did. We went and did some in-depth research with South East London, where there is an integrated service, one of the most advanced integrated care ICSs in terms of HIV. And even there, where they have very high prevalence and they know largely what they are dealing with and they know the populations where this is the biggest problem, they struggled to make sense of this fragmented commissioning service. Now, I'm not asking that all the funding be put into the NHS. I'm most definitely not asking for that, because we all know, my lords, that once money goes into the NHS, it never ever comes out again. And I do think that there is a case to be made for increasing the budget, not least the budgets of local authorities which have been slashed, in order for them to carry on doing what is important, which is getting to people long before they are anywhere near being any kind of medical priority. But what I'm asking for in this amendment is a formal duty to collaborate. One thing is, I have no doubt that the Noble Lord the Minister will say that that is not necessary, it is not. Well, we can't carry on doing that. We are wasting resources, badly wasting resources, when we should not be. We have, I think, in this House enough knowledge of the levers which make people in decision makers and commissioners change what they're doing. Not least when they do understand that there are new and more efficient ways to meet the needs of population. So I think with not a great sense of hope, I do stand up to propose this amendment, and I hope that the Noble Lord, if he doesn't accept it, will at least understand that we cannot continue in this inefficient way of dealing with known issues, and that we stop failing people where we could be sorting out the issues quite clearly.